Mandibular movements are related to three planes of the skull: the horizontal, frontal, and the sagittal. The mandible rotates in each of the three planes of space. The point of intersection of the three planes is called the center of rotation. Mandibular movements may be divided into two main types of movements: basic or functional movement. Basic movements occurs at the level of the TMJ, and it can be divided into two main types: the rotational movement. The rotational movement occurs between the condyle and the inferior surface of the articular disc. Centric relation, which is called uppermost, rearmost, midmost, or most posterior position, is a purely rotary movement about the transverse horizontal axis. The other type of the basic movements are translatory or gliding movement. It takes place in the upper compartment of the TMJ, which means between the superior surface of the articular disc and the glenoid fossa. These movements called mandibular border movement. The second mandibular movement is the functional movements. All mandibular movements except the terminal hinge movement, are combination of rotational and translation, are most frequently and are referred to as being functional movements. That means that all the basic movements which are related to the terminal hinge movement are related to the centric relation. So the functional movements are all the other types of movements except the terminal hinge movement. These movements can be summarized with opening and closing movements, symmetrical forward and backward movements, asymmetrical sidewise movement or lateral movements. The most important functional movement is the opening and the closing movements, which can be divided into habitual and border movements. Border movements is defined as the mandibular movement at the limits dictated by anatomic structures as viewed in a given plane. Take place within three-dimensional limits. The mandible can move about 10 millimeters laterally, open about 50 to 60 millimeter, protrude approximately 9 millimeter, and retrude about 1 millimeter. The border positions are limited by nerves, bones, muscles, teeth when present, and ligaments. As the definition suggests, border movements are recorded in three different planes. A pantograph is required to record all border movements. The pantograph is an extraoral tracing device. Extreme movements in the sagittal plane. A characteristic bird beak-like tracing is formed while recording border movements in the sagittal plane. Here the patient is instructed to move the mandible from centric relation, abbreviated as CR, to centric occlusion, abbreviated as CO. Then to the edge-to-edge relationship, ER, guided by the incisal guidance. Progress further forward to the maximum protrusive MP position and then arc downwards to the maximum mouth opening position, MMO. The next two slides are related to the extreme movements in the sagittal plane for more clarification purposes. You can notice that the border movements subdivided into anterior border movement appear as one arc in the sagittal plane, and posterior border movement appears as two arcs in the sagittal plane.